of the really awesome things happening in plastic surgery right now is a new type of fat grafting that is really changing how this has been done, and it's become very popular. It's called expansion vibration lipofilling. EVL, which is just a fancy way to say fat grafting, utilizing some concepts to make the fat live better or take better. With traditional ways to fat graft, you really can't place a whole lot of fat at once because the fat will resorb or it would go away if you try to put too much in. With EVL, it really allows us to at least double the amount of fat that we can put in at any one single time. And I think it actually allows us to pretty much quadruple the amount of fat that we can put in if done properly. So we use some expanded cannulas that allow us to expand the area that we're about to put the fat in, right before we put the fat in, just a fraction of a second before. And then we're also utilizing a really fast movement, which is vibration, and it disperses the fat really evenly and very smoothly. And then we're also pre-expanding the area that it's going in, so it's now got a place to live. EVL also allows us to get way better fat graft take. One of the challenges in fat grafting is the fat goes where we don't want it. So the areas that are easy to fill up, lots of times are not the areas that we really want to fill. It's the areas that we want to fill up that are sometimes the hardest to fill. For instance, when we're talking about the buttock, there's an area called the mid-buttock that is really hard to expand out, and that's always the area that starts to collapse. Well, we're able to expand that area, vibrate that area with the device, put fat in there, and keep it right where we want it, and it stays there, and we get great results without having to overdo some of these areas. I get a lot better results with EVL than typical ways to fat graft. I'm able to, in one setting, be able to put all the fat that I want in to get the results that my patients want, and then we're done.